All right. Well, we have a small but committed group tonight, right? Okay. So what we'll do is, it actually was kind of challenging for me to preparing for this lecture because preventing running injuries in 45 minutes or less. The challenge is describing what injuries you can get, and then you better talk about how to not get them. Well, then what if you do get them? How do you get rid of it? And so that ends up. I'll try to cut 2 days down into 45 minutes. But so y'all are running tomorrow?
Yeah.
All right. I have run. I'm not running tomorrow. I have run in this race twice. I am not a runner. To me, running with every step, it's an opportunity to stop. That's why I like basketball. 96 feet max. Otherwise, you run into the end of the gym. So that's why basketball suits me. So we can keep this pretty loose today too. If somebody has a question or a concern or something specific, hey, raise your hand. We'll talk about it. This is your lecture. It can go whatever direction you want it to go. So we'll go through a fair number of slides relatively quickly because I do want to get to shoes. I want to talk about shoes. So, but like I said, we can go wherever you want. People ask me a lot. Can anybody run? Should everybody run? And I say, well, absolutely. It's great for business. The 65% of all runners will have one of these injuries in any given year. The injury rates are through the roof. So one of the things that happens, our tissues have specs, just like building materials. Roof trusses have specs. You exceed the specs, the roof caves in. Our tissue is the same way, whether it's a bone or skin or muscle or a tendon or a ligament. And where those specs are, where that threshold that if you exceed it, things break down, where that is really determined by your strength, your flexibility, your load distribution, your ability to dissipate load and absorb shock. And the only thing that separates us from roof trusses is rate of repair. We can actually get better and put things and knit things back together. But this threshold raises and lowers with this relatively, and actually just over time with age does begin to decline. And I hear a lot. People will come in and they'll say, hey, I've been running 20 miles a week for 25 years. Now all of a sudden my heels hurt, my knees hurt, my hips hurt, my low back hurts. Yep. What have you done other than running to affect this? And so that's one of the first things we go to. One of the best things for business for me over the last decade has been the half marathon, because it gave Joe Average Bag of Donuts recreational runner an achievable distance. The marathon for a lot of people was just too intimidating, but that half marathon. And so, these 10-mile-a-week people, they start increasing that mileage and ramping up to that half marathon. And then all of a sudden they cross that threshold and things start breaking down, and then they get to meet me. And they become a physical therapy patient. And unfortunately, left to their own devices, once you injure tissue, it can't withstand the stresses that it was a while ago. And so you have to really cut your training back until you can improve this and get back on the road again. So, preventing running injuries, though. So we could talk a lot about training errors. Just what are you currently doing in your training that is causing problems for you? We can drill down on that. Or we can look at biomechanical faults. Now, some of that might be governed by your anatomy. It's just what God gave you, and you can blame your mom and dad, but those feet are, a train wreck. Or it might just be how you're functioning and the habits or bad habits you've picked up, or just errors in how you're getting around this planet. Shoes. Sometimes it's just a bad marriage between that foot and that shoe and that surface, and we'll talk more about that in a little bit. And then, what are you doing to strengthen and stretch and maintain balance, left to right, front to back, proximal to distal, that is not just running? And so that's sort of the rehab or prehab to prevent injuries. So a lot of the common biomechanical faults, I see this a lot. And actually, I probably should back up a little bit. I use the term runners pretty loosely. You all are runners, because tomorrow you're running. By definition, you're running. But really, there's runners, and then there's joggers. And actually, then there's another category, I call them plodders. They just kind of plod along, and they may not actually ever have both feet off the ground at the same time, which would by definition call them a runner. But they're plodding along. And you can just see then the mechanics are different when they go by. And so those are some of the things that we address, because it really beats up the system when mechanics break down. And you'll see very commonly, people overstride. They get the foot too far out in front of them, and that'll be in combination with a hard heel strike. But that's impact load that goes right up the chain. And it's also the brakes. That's how Fred Flintstone stops the car, is he gets the foot out in front of him. So it's not very efficient. And you can see a much more upright posture versus a forward lean. So those are a couple things that we look for. I see this a lot. People sink when they're in mid-stance. And we measure this. We videotape folks and measure this. And that's one of the things that that I find a lot in foot and ankle and lower half problems, because not only is the knee flexion angle greater and the force attenuation greater, but it also puts those tendons on a stretch, because you end up with a deeper angle there as well. And so we look for a little taller runner. Don't sink so much. I see scissor gaits a lot. People will actually cross in front of themselves. And that trochanteric bursitis or hip bursitis is very common. Fifth toe stress fractures, because as that foot is crossing, it's hitting the earth like this. And so you kind of trip the foot. And you'll beat up the lateral column of the foot a lot.
That causes a stress fracture?
It can.
You hit like that?
Yep. The fifth metatarsal stress fractures, Taylor's bunions, fibular stress fractures. And because it's tripping you then into pronation, you can have a whole host of pronatory problems then too. And so that's one of the, we see that commonly.
Shin splints.
I'm sorry?
What do you think causes shin splints?
About 100. What causes shin splints? Probably about 50 different things. So we're, and that's one of the things that you can't just make sweeping generalizations and about, oh well, you must be a pronator, then you should wear this one. And that's what happens way too commonly, because shin splints can be because you have a pronated foot and don't shock absorb well, so your shocks are bottomed out. Or it can just be poor flexibility and you have a high arched stiff foot and you're landing like this and beating things up. So opposite biomechanical issues can cause the same symptoms. You got to be able to tease that out. And that's what we do with, we'll put you on a treadmill and videotape you. So one of the training rules, and it just keeps coming up and over, and gosh, I was really fortunate. I got to teach sports nutrition up at WSU for a while, and man, did I learn a lot teaching sports nutrition. But that's one of the most common things that I see is people just aren't nutritionally sound. And they're trying to live off of goops and goos and gels and jelly beans, and thinking that they're keeping their fuel on the fire while they're running, but they're not eating food, or they're just not getting rich, good sources of food. And one of the things that drives me insane, though, is nutrition is one of those things that probably all of you in this room have some element of expertise. You really have some kernel of truth about nutrition. It's something that most of us know a little bit about because the information is everywhere. But some of that information is accurate and some of it is horribly wrong. And it's hard for us as just, consumers to know crap from cream. And so when you get nutrition advice from the person who's lining up next to you at the start of the 5K, well, that's probably what he'll say to you is, well, you're probably gluten intolerant. Well, if that doesn't work, cut out dairy. And so that's what I mean by, make sure you're nutritionally sound. And maintain adequate hydration. Not too much, not too little. There's a tendency in our culture now, we overhydrate like crazy. These kids would come to my class, and 3/4 of the class would have water bottles sitting on their desk like they're prepared to cross the Kalahari Desert. And they're just drinking water. And especially for these endurance events, we really are overhydrating in a lot of cases. We're bloated. And that creates some other problems, really potentially serious problems, hyponatremia, which can be potentially fatal. It's rare, but it can be a problem of overhydration is real. This is one of the other common things that I try to adjust for folks who are really not even really novice runners, but people just try to just keep adding the mileage. They start out at 10 miles a week, and then they get pretty successful, and they do that first half marathon, and boy, their training ramped up to 30 miles a week, and now they put their sights on that first marathon, and now they're up to 35, 40 miles a week, and same pace, just more of this. And eventually things break down and they end up, muscle imbalances. And what I really try to get people to do is cut back on the quality and do something else to improve the system. Running alone is not the key to being a good runner. You have to cross-train and you have to do supplemental exercises. And it's really difficult. That's a tough sell to try to convince a runner to give up a run day. You have to manage the impact loading. We talk about feet, we look at feet, talk about shoes, and the surface. Including the terrain. Is it uneven terrain? Is it hills? We live in Pullman. There's, the city playfields and the Chipman Trail are the only two flat spots in Whitman County. And being biomechanically sound, like we talked about a moment ago. And all of these kind of end up just, there's a lot of gray area here. Maybe 50 Shades of Gray is not the appropriate moniker, but everybody has a little bit of the truth, and things have to be tailored to fit you, but you have to have an appreciation for these overarching elements. Being biomechanically sound, and really the whole lower half. And are you training the muscles, and we'll talk about the foot muscles first, are you training those foot muscles to do their job? Feet have three major functions. First, they function as a shock absorber. They're the first thing to hit the earth. So they have to shock absorb and attenuate load. You engineering students will get that. Then they have to adapt to the terrain. Now, for most of us, it's pavement and asphalt and the like. There's not much to adapt to. But I'll show you a picture here where it's like, oh, well, yeah, I can see how that'd be different. And then they have to transform. So they become a loose bag of bones as they absorb shock. And then now they have to transform to a rigid lever for push-off. And those are opposite functions. It has to shock absorb, and then it has to be rigid for push-off. I defy the engineers here in town to design a machine that will perform opposite functions 10,000 times a day for 90 years, and for the most part without fail. It's a biomechanical marvel. And we hear this a lot in the literature and at the shoe stores. And pronation has kind of become this nasty four-letter word, and it's really not. Pronation is necessary. That's how we absorb shock. You just need the right amount at the right time. This is something that was a bit of an aha for me over the years and you might appreciate when you line up at the start line tomorrow, start looking, and you'll see that these, especially even the experienced runners, don't have no butt. They're just whoop. And what I see is that running alone doesn't really train the butt very well to do its job, and you'll see in a couple pictures here how that can really lead to injuries. When your glutes fatigue, tensor fascia lata, another muscle, starts working harder when it shouldn't. And you get some muscle substitution there, and TFL attaches to the IT band. People that end up with IT band problems and IT band pain, people will tell you, oh, your IT band's tight, you need to stretch it, you need to foam roll it, you need to do this, you need to do that. It's not that your IT band is too tight, it's probably just under too much tension because the muscle that attaches to it is working too hard and working when it shouldn't be because the butt's weak. The butt's not doing its job. The short hip rotators, a big group of muscles underneath your glutes, the deep muscles of the butt, they control leg rotation and assist with controlling pronation. They really have a big impact on what our feet do. And the hip rotation is necessary for shock absorption, stride length, and energy conservation. And that's what I actually have a book in the works, the Runner's Guide to Treating Foot Pain, and the tagline is the butt and the big toe. That's really where the magic is. And what I found was when I started training the butt and the big toe specifically, pain went away. And it's like, oh, okay, there's got to be something to this. So here's an illustration of that. This is based on EMG studies. When are these muscles working and when are they not? When they're pink, they're working a little bit. When they're bright red, they're really firing, and then the butt shuts off. And then it turns on again at heel strike again. So the glute fires from heel strike to the foot flat. That's when it's really on. Well, that's also slowing down the rotation of the leg, which is a component of pronation. So you need the glutes to help slow down pronation. Here's that TFL muscle that I was talking about. It attaches to the IT band. When the foot is hitting the ground and you're in foot flat and mid stance, it should just be pink. It should just be barely working. What do you suppose happens if the butt is not? Now this thing's bright red. It's working hard when it really shouldn't be. And it's putting tension on the IT band. And it should just be working over here. This is its job, is to help bring the leg through. So
how do you strengthen that, or how do you make that work
the
better?
glutes?
Yeah.
I have a whole host of exercises. They loosely call it in the clinic, Ed, you want them on the butt and the big toe program? Yep. Okay, here's the list. But even simple things. You've seen the Versaloops out there in the TheraBand. Grab one. Put that around your ankles and do defensive slides with the TheraBands around your ankles. Walking lunges, squats. A couple, throw a couch cushion on the floor and kneel on it. Put both knees on it. I'll demonstrate it for a moment, if I can. And just kneel on the soft couch cushion and nice and slow, bring one foot up. And then nice and slow, put it back. And just like Tai Chi kind of slow. Your butt muscles are the only muscles here that can control this. And it's really hard. I bet 3/4 of you will fall over if we tried this right now. It's easy.
Just to keep your knees.
Just to protect the knees. Yeah. It's easy to go quick. That's not the challenge. The challenge is to go really slow. Balance and stability. And just think Tai Chi, and you'll be all over the place. So that's one of the really good ones. And it recruits those butt muscles to do their job. Heel pain. How many in this room have heel pain or have had heel pain, myself included? Okay. So a couple things that I was just talking just briefly a moment ago to a fellow heel pain person. So plantar fasciitis is one of the most common diagnoses, and it really is one of the most common sources of heel pain. But you also have a fat pad right here that is highly innervated. It's essentially a pressure sensor. And when you, what we call a stone bruise, when you bruise that fat pad, it'll stay bruised for months. And it is essentially your body's protective mechanism to say, get off your feet. Take a break. You're beating us up. And it helps, the pressure sensor is to help protect these deeper, more important structures. You also have a nerve, it's called Baxter's nerve, that comes down out of the tarsal tunnel. So sometimes tarsal tunnel syndrome, which will give you pain. It runs right over the top of that plantar fascia, and this gets misdiagnosed a lot then too. So sometimes your heel pain, the root of that is up in the tarsal tunnel a little bit. So those are a couple differential diagnoses for heel pain. But look at the muscles in the bottom of the feet. How many of you guys do foot exercises that train these muscles to do their job? So that's the second layer. There's the third layer. There's the fourth layer. And there's actually another layer. These are really complex muscles. And if you look at them, some of them are pretty husky. Those muscles are there on purpose. They have a job to do. And 99.99% of us just shove them on our Asics and hit the road. And we don't address them. And I got to tell you, a lot of times we just have lazy feet that aren't doing their job. We compensate those, we get by because our shoes are so supportive now for the most part. But a lot of the way out of foot pain is to specifically retrain these muscles. So I look at this and I just think, man, this is just an engineering marvel to me. That's how I like to see feet. That's the best way to see feet. Those are mine. So a shock absorber, I mentioned earlier, and this would kind of illustrate, if you think feet don't shock absorb, put them in a ski boot and try to walk cool. The feet can't just be rigid levers all the time. It's great for propulsion, but they also have to shock absorb and be flexible. And adapting to the terrain. Walking on cobblestones, walking on the beach, walking on the breaks of the salmon river when you're chucker hunting. That our feet have to be able to adapt to the terrain and then, in that position, transform to a rigid lever for propulsion. But some feet don't do that very well. Some feet are like swim fins. And it's hard to, you can imagine, well, it's probably hard to run fast in swim fins. Well, there's a pair of feet that are like swim fins. I see those a lot. That's a loose bag of bones. And that was really a challenge. He's actually a cyclist. That was his issue. He really wasn't much of a runner, but his feet had really lost all ligamentous integrity. This I get asked a lot. So what's a normal foot look like? Well, this theoretical normal feet, and a lot of people have pretty normal feet. You just look for alignment. There's 4 alignments that I look for. Does the heel line up with the lower leg? Does the heel line up with the ground? Does the heel line up with the forefoot? Does the front of the foot and the back of the foot, are they on the same planes? And does the front of the foot line up, is number 1 line up with 2 through 5? And those are what I call the functional alignments. And that's the first thing I check. Get you on a table and check those 4 functional alignments and see, do you need a front end alignment? It might be easier just to go to Les Schwab. So what foot type? You'll see this illustration a lot. And it's been around forever. And this is a very simplified illustration that'll help give you some clues as to what foot type you do have. If you leave an imprint in the sand, or if your feet are wet and you walk across a wet paper, a paper towel, and you leave a foot imprint, if it looks like Fred Flintstone's foot, you probably have a pronated foot or a flat foot. If it looks like that, you have a pretty neutral foot. If it looks like that, you have a very high arched supinated foot. That's what we call a supinated foot. The shoes you want to look for, if you're pronated, is a motion control shoe. We'll talk more about that. A neutral foot just needs a little stability. And those high arched feet tend to be stiff feet. They need cushion. Don't put a stiff foot in a stiff shoe and run on a hard surface. It's a bad combination. Shoes. Let's talk about shoes. Well, we'll leave it there for a moment. Do I want to leave it there for a moment? I think the yellow ones at the bottom are Elton John's. Yeah, Converse. I have a pair of Connies here, and Nike. I have a love-hate relationship with Nike. I hate them for what they've done to the shoe industry, and that they've literally sold their soul for fashion. but I love them because they're so good for business. You just won't find a serious runner, very rarely will you find a runner, a true runner that runs in a Nike. And even, you know, all these Nike shoe contracts that the colleges have, they just destroy athletes. So what we'll do, we'll talk about, okay. So shoes, when you go, this is what's so challenging. You go to the wall of shoes, and you're like, I don't know, there's a blue one. That's pretty cool looking. Okay, I think I can afford it. You put it on, it's like, well, it doesn't kill me. I'll take it. And it's like, how do you know? And so what I've done here is I've sort of aligned this row of shoes from really, really, really stiff motion control to more the just the neutral stability shoe to the really cushioned shoes, or even the, what's the term? Oh, golly. The one? Minimalist, thank you, the minimalist shoe. And so we can talk about each of those. When you go to the wall of shoes, well, first of all, leave an imprint on a paper towel with your foot wet when you get out of the shower, and it'll give you an idea. Do I have a flat foot, or do I have a high arch foot, or something in between? And the way to separate out shoes, grab them by the heel, grab them by the toe, and bend them. And just see how resistant to bend they are, and give them a twist. And see how resistant to torsion they are. And you'll get an idea of, well, I can just put that in my pocket and go to the gym. You'll get an idea of you know, how much integrity and support does this have? And so we'll just start. Just pass that around, bend it and twist it. And also see where it bends. When you grab it by the heel, does it bend back here by the heel? Does it bend in the middle? Does it bend towards the toe, or anywhere it wants? And see where that shoe wants to bend. So here's a Nike. So I bend it right in the middle of the arch. It's where that shoe hinges. Because Nike has eroded away at the midsole so much, this shoe has no choice but to bend in the middle of the arch. And now, if I have a person who has a high arch foot, I might be okay with this shoe because it will be cushioned. It's all just white foam. It will be cushioned, and their foot is so stiff, this probably won't bother them much. So they might do okay with it. But really, this shoe is probably going to be painful for most people. I'm sorry?
Is that a stability shoe?
That is a cushioned shoe. Oh. Yeah. So the next one, coincidentally, just happens to be a Nike. And I should say, I could take any shoe brand and go all the way from one extreme to the other. I could do this with all Asics. I could do it with all Saucony and even Nike. I could probably do maybe get some on the internet maybe that are more of a stability shoe than in a Nike. I don't even know if they make one. But for the most part, brand doesn't matter anymore. They all make the full range. This shoe, you grab, hey, only really wants to bend at the toe. It's a lot stiffer. When you look underneath, there's a plastic piece there. It's called a foot bridge. And that just makes it a little stiffer through the arch. Makes it just a little bit more closer to the stability shoe. But it's still, and if you still, well, gosh, you know, I weigh 180 pounds. I'm still going to crush it when I load the shoe, or after a few miles. It's going to give way. But at least it's different than the first one. The next one in line, you'll start to see the emergence of what we call a dual density midsole. It's got this dark gray foam that's a little stiffer, and it just makes the shoe a little stiffer, and it just is less likely to collapse on that soft foam. So this is really a kind of a middle of the road stability shoe. And so as we work our way down the line, the amount of dual density midsole gets bigger. The foot bridges get a little more prominent. And I got to tell you, you're going to see all manner of combinations of foam and lights and water and gel and bells and whistles and pulleys, and really for the most part it's just somewhere on that line of how stiff is this shoe. What I should say too, lift up, take the sock liner out of the shoe and look at the inside. That shoe that's coming around, you'll see when you take the sock liner out, you'll see that it's just white fabric in there. Is it felt or something, or is it gray? It's kind of a gray. Synthetic gray. Yeah, it's kind of a synthetic material. And I'll send this one around then too. Nike glues theirs in. Do you hear the annoyance in my voice with Nike? It's just fabric. This shoe has cardboard under it. It's a little stiffer. That's called the last. Hundreds of years ago, 100 years ago, the last is the part of the shoe that would give a shoemaker that would determine the shoe's size and shape. He would start with the last, an 8.5 triple E, and about that he would create the rest of the shoe. And so that cardboard piece, or even that fabric piece, is the last of the shoe. Some of them are more flexible than others. The cardboard is stiffer. And so it contributes to that shoe being stiff. And so now that shoe's moving more into the motion control. And we're kind of through the stability shoes and getting into the motion control side. And they get stiffer, don't they? Like profoundly stiffer. And now we get into the extremes. The other extreme from this really flexible shoe to a really, really stiff shoe. And I got to tell you, I probably take more of these shoes away from runners than I do recommend them. This is just like a ski boot. It is just crazy stiff. It will hinge sort of at the toes, but holy cow. If you need a hammer and you can't find one, you could build a deck with this. If you're changing oil on a car, put it under the tire and the car won't move.
When do you want a stiffer shoe?
If you have a really loose foot, a really unstable foot, and you're overpronated quite a bit, then you want a shoe that'll compensate for that. Because you remember, your foot has to be a shock absorber, but it also needs to transform to a rigid lever. And if your foot's not very good at being a rigid lever, you need a shoe to help it. And I probably shouldn't. You need a stiffer shoe to help it. This is a beast. The only people that I really recommend this shoe, and Saucony makes Brooks makes the Brooks Beast. Saucony makes this Stability Max. Every shoe company has one that's just a ski boot. The only people that I recommend this for are people that are really pretty big, like 300 pounds-ish or whatever. They're big, and they have to work on their feet. They have to be on their feet for a living. They stand all day long, and they just need a shoe that won't break down because they're big. And but they're not going to run and pound the earth with these. So anyway, I'll pass that around. One of the things that is still a challenge, though, is like, so you mentioned, when do you want a stiff shoe? So that overpronated foot, though, is still, collapsing. And if you look inside, that's still flat. And this gives you the illusion that it's an arch cushion. It's really not. It's 1/8" molded foam. There is no arch support here. And so this is flat, and that's flat. And so very frequently, I'll have, when people go get a stability or a motion control shoe, I'll have them supplement that shoe. I'll have them take this out and throw that away and put an arch cushion in. It's neoprene. It won't, it's very durable. It'll outlast the shoe. But it's not hard. If you are a pronator and your arch does collapse, you won't feel like you're hitting a golf ball. A lot of people get custom orthotics when they pronate a lot, and they hate them because they just collapse into that hard plastic shell and it just hurts. So this is what I put in my kids' football cleats and soccer cleats. and because those also hard plastic, flat shank, nothing on the inside. And so I hand these out a lot. Again, partially, actually I have a pair on right now. I'm wearing them in my men's dress shoes. So, because I stand all day long on concrete. And so it gives me the support and cushion that I need. So that's sort of a nice, inexpensive, very durable, over-the-counter cushioned, arch cushion. So, okay. Questions so far? Yes?
So,
Go ahead. Ladies first.
What are some signs to look for to know if a shoe is breaking down? We probably all like to get the most out of them because they're expensive.
Right.
But nobody wants to get injured because we're running on old shoes. So,
Terrific.
So how do you tell?
So the question is, when do you know when it's time to go shoe shopping again? Conventional wisdom out there is that around 400 to 600 miles, if you're a runner and that's your running shoe, about 400 to 600 miles is really the end of its useful life. The white EVA foam loses about 50% of its resiliency at about 400 to 600 miles. And so then you'll notice that, gosh, now my knees are starting to hurt now. And they didn't, when these shoes were new. You'll just notice that they just don't cushion as well. The other thing that you might notice is that now you see one side might start to collapse. If you land, especially some people tend to land hard on the outside of their heel, and you might start to see that starts to collapse a little bit. When you start to see this heel counter, when the shoe is on the table, you put your finger down through the heel. If that isn't straight up and down still, you need to let go of it. Now they're gardening shoes, and you go get a new pair. Look at the bottom and see if you have abnormal wear patterns. When those start showing up, time to go get new shoes again. When they lose their alignment with vertical, that shoe's starting to break down. And so it's really an expensive proposition if you only get 6 months out of a pair of shoes. But price has no bearing on quality. If you go to Sport Town, and Joel at Sport Town knows as much about shoes as anybody on the Palouse, and they do a great job. But you're going to get the current model of that shoe, and that's not going to be cheap. So you can find discounted shoes everywhere. So here's a little story. Several years ago, my wife and I went on vacation down the Oregon coast. She was a recreational runner. She left her running shoes at home. She wanted to go for a run wherever we were. She's too cheap to go buy a new pair of shoes. And so we went to Payless at Shopko in Newport, Oregon. And she picked these. She picked out these shoes, and she goes, well, these aren't hideous. What do you think of these? And I thought, well, it's interesting. Kind of stiff. Little foot bridge. It's like, oh, okay. Hey, these were really almost exactly like her Stability New Balances that she wears. She wore them. She liked them. She actually came home and she got 400 miles out of them. They were $12. So I loved them because they were $12. Yeah. So you can go to Shopko. And the choices are limited, the color selection's limited, or you can go online. And I tell you though, once you find one that works for you, go buy 2 pair. If you find something that works, stick with it. So because these models change and disappear, and they reconfigure them so they can sell more of them. So anyway, is that helpful? Yeah.
This question wasn't really related to shoes, but it was on running uphill and practicing running uphill. What is the safest way to practice? Is it like on the treadmill or
to practice uphill? So your question is, what's this?
The question was like, would running uphill hurt, injure you, or would running downhill injure you? So is flat the best?
Flat is the best.
Okay.
The hills really, both up and down, present different problems, but they do really create challenges. So you saw just on a flat a certain knee flexion angle and a certain angle at the ankle. Now you add an incline, that just gets accentuated, and the stride shortens. A lot of times you'll see the pelvic rotation increases just to try to maintain a stride length, and that's going uphill. So not only that, your energy expenditure just goes through the roof. So people generally don't have impact loading problems going uphill. They have stress and strain issues, Achilles tendonitis, posterior shin splints. Those tendons have to go around the corner at a sharper angle. Forefoot issues because you're really loading the forefoot. Vertical, and this is FYI, maybe you're an engineering student, but vertical loading forces are greater at the forefoot than they are at the heel. We have a little spike when we heel strike. Some of us don't even heel strike at all. But the forefoot takes a beating. Coincidentally, if you look at the forefoot of just about every one of these shoes, they're identical. Shoe companies haven't quite figured that out, that really the forefoot is pretty important. And every one of these shoes has about just this much white foam, and then all the bells and whistles and gizmos are all back here at the heels, and some of us don't even heel strike at all. So that's kind of like, okay. So downhill, now we have impact loading problems. We hit the heel and the heel gets tripped and we slam forward. We impact load and it jams the system all the way up the hips, knees, and low back. We end up with IT band problems, bursitis, tibial stress fractures. So find something flat. And especially if you're rehabbing from an injury, stay flat and gradually add your heels for training. But yeah, running down hills pounds. And my leg on the 100K was an 8-mile downhill. I was sore for days. My ribs hurt, and I think it's just from my internal organs slamming against my ribs. So good luck to you. Yeah. So, yes.
Another shoe question. I have small children, and those little munchkins grow so fast.
Yes.
And I think it's ridiculous to spend $60 on a pair of shoes that someone's going to wear for 2
Right.
months.
Yes.
But I also don't want to set up my kids
Right.
for later to
Great.
have foot issues.
Yeah.
So what's the balance and what's appropriate for children?
Great. Don't spend a lot of money. Buy them a shoe that they'll wear. It's got to be cool, or they're not going to wear it. And it does need to fit. So, just like most of us, we try to go maybe a half a size, too big, and they'll grow into it. I'm okay with that. These same rules will still apply, but about like protecting their arch and the like. Don't worry too much about that. Most children don't really develop an arch until about 7 or 8 years old. And so if your 6-year-old is flat-footed, naturally, don't worry about it. That's normal. And in fact, boy, when summer comes, take their shoes away and have them outside and playing and exercising and training those muscles. Have them, balancing on everything and pedaling their bikes and play, and barefoot is okay. So, yeah, but so really, once they start their school sports and soccer and basketball and the like, now you kind of know how to separate, crummy athletic shoes from not. But boy, for an everyday shoe for a kid, don't worry too much. Let affordable price and a shoe that the kid will wear govern that. Yeah. So, and make them lace them snugly. Yes, and if you can convince my college-age kids to do that, I would appreciate it. So this is what drives me insane is, these guys don't even probably know how to tie shoelaces. They wear them, loose. And skater shoes, fortunately, are starting to work their way out of our culture, thank goodness. But sorry, I hope I'm not offending anyone. But kids would go into those very, very cheaply made skater shoes that they don't tie, and the feet just are allowed to do whatever they want to do, and they hang on their ligaments in there, and they just destroy feet. So I get asked a lot about Birks and Crocs. Crocs are okay. They're just EVA extruded foam. They just won't last. About 3 months, and your Crocs are going to be done. So get a new pair every spring. Wear them in a garden. Because you can hose them out. They have a contoured footbed, so they're okay. And you know, you can make your own style judgments about them, but so, and Dansko's, for the most part, a large majority of our nurses who are on their feet for 12-hour shifts walking on concrete wear Danskos. The rocker bottom and the undercut heel, just kind of your foot is, and also with the elevated heel, the bones are stacked a little bit. And so it gives you a fairly stable foot. But there is no cushion there. They're stiff and hard. But the foot is up a little bit and the bones are stacked, and they tend to be pretty good for people. So.
I put those on and my feet hurt.
Yeah.
It's the one we used to.
Yeah, and she did not do well in hers either.
For years, and then I had the heel problem. I couldn't wear them all winter.
Okay.
It just hurt.
I'm really curious about your heel. I want to see your heel. Yeah. But to that point, there is not a shoe that works for everybody. There's no such thing. Yeah. These are okay if you want to go boating or camping or rock climbing or, you know, work in the yard or what have you. They're a moccasin, and they function like moccasins do. But if you have been a runner and you've been running 20 miles a week very successfully in your ASICs, and you just decide, I want to get on a bandwagon, I want to run in a minimalist shoe, don't just strap these things on and head out on the Chipman Trail for your 13-mile long Saturday run. You'll call for help. But if you're really committed, you really want to transition to these for whatever reason, and you have pretty normal mechanics, if you back way off on your training and way off on your mileage and allow time for your feet to adapt, allow time for your running mechanics to change, you might be able to transition to these and gradually increase your mileage. The craze is really on its way out. Thank goodness. These were great for business. I kind of miss all the people, but they're on to something else, I'm sure. Yeah, and you'll run into people. They swear by them, and the reason they probably swear by them is they spent $80 on, and they're embarrassed to say that they hate them. So, everything else on that page is really crap. So, and sometimes you got what you got, and you got to go with it. And it's our job then to try to mitigate, you know, some of the anatomy that God gave you. It's really amazing to me, though, to stand at the end of the half marathon and look at the people crossing the finish line. It's really remarkable, and I just admire people's perseverance. And you know, you'll see all kinds of running mechanics too. People that just run like a camel, and they're doing great, and they're symptom-free, and they're happy, and they're turning in 8-minute miles. And it's like, how could that person do that? It's just a broad range of normal that's out there. And some people are just blessed with good tissue that can take a lot of pounding, and others just aren't. So, anyway. Any other questions for tonight?
Another shoe question.
Yeah.
Women are being marketed women's shoes that are made for like special women feet. But really, is there anything particularly special, or can we just buy men's shoes and pay $20 less?
Ooh, the challenge you'll run into with buying men's shoes is the heels are going to be wider. And so you're gonna have a hard time finding good heel control in a men's shoe, and the forefoot is wider. Now, sometimes, very commonly, women in their childbearing years or afterwards really find out that my foot just grew a half a size, and really maybe even a full size because now my foot's wider at the forefoot, and there tends to be a very high correlation of forefoot splaying with all the ligamentous loosening and all that goes on. So sometimes because of that now wider, longer foot, it's hard to get comfortable in a women's shoe. So you just have to. So if you do, then you might put a heel cup then in the heel to try to tighten up that heel counter a little bit so you're not slopping around back there. There's really no other special differences between women and men, and for the most part, the people that are making women's shoes are making them to fit a woman's foot. They just charge more because they know they can. But a men's shoe is going to fit you differently. So the women's dress shoes, the European brands, they do pretty well. Is it Bonds? Yeah. Are pretty good. Macy's has a pretty good selection of pretty good women. Like I said, the European brands do pretty well for supportive, relatively attractive, something you can wear to work, and have a good supported shoe. On the men's dress shoe side, the Rockports, the Clarks, the Bostonians, those are good men's dress shoes. Throw a Spanko in there, you'll be happy all day. So, yes.
One question about, you said our foot has 4 layers of muscle.
Yes.
And you said sometimes muscle doesn't do the job. So any exercise you recommended to practice all the muscle?
Yeah. So there's actually several, but something just as simple as standing like a stork. So you stand like a stork, and see if you can stand like a stork for 60 seconds with your eyes closed. And so you got to brush your teeth in the morning, standing like a stork, and don't fall over. But even just practice at first, just standing like a stork, and you're going to feel, whoa, this is how we maintain our balance, is those fine-tuning adjustments in our foot and ankle. And those muscles, you'll start to feel the burn, and you'll start to feel those muscles working really hard. And very slow calf raises. And what I want you to do those is make an arch. So you kind of roll up a little bit, and then very slowly up on the ball of the foot, and load the toes, and then very slowly come back down and keep the arch. Don't let it just collapse in. Another one is what I call a towel drag, which you set a towel on the floor, put your bare foot on it, and try to pull that towel towards you using the pads of your toes. Not the claws, don't dig the nails in, use the pads. And it makes those muscles in the foot, you'll feel the burn in your bottom of your foot. And as you drag that towel towards you using your toes. And then try to pick things up, get some dexterity. You can actually learn to, write your name and pick up marbles, and that helps retrain the muscles of our feet. This was actually one last final story. Had a really significant impact on me. I was probably 8 or 10 years old, and this was how long ago it was. You could still smoke at Denny's, but the gentleman comes in and sits at a table adjacent to us, and he was wearing kind of a jumpsuit kind of a thing. And waitress brings him a cup of coffee and a menu, and he kicks his sandals off. He's wearing flip-flops. Kicks his flip-flops off. Reaches up with his foot into his shirt pocket, shook out a cigarette, put it in his mouth, set the pack of cigarettes on the table with his foot, reached back up in here, pulled out a Zippo lighter, lit a cigarette, and set it on a table, picked up a cup of coffee, and drank it with his foot. He had no arms. He was born that way. But he had developed the dexterity in his foot to be able to light a Zippo lighter. We have that kind of ability, we just don't try. We've never had to. And so, but those muscles down there are capable of a lot. They're very similar in arrangement to our hands. And we need to go back and make those feet do their job. Our feet get lazy. So.
And also about the warm-up and also the stretches after running, is there like a minimum required time?
So yeah, her question is, stretches for warm-ups and after you're done running, a minimum required time. There's 2 reasons you want to stretch. One reason you want to stretch is to kind of warm the system up and get it ready to go. Just like you'd start your car and let it warm up in the morning. You don't just start it and take off. Well, maybe you do, but that's not good. And so, we stretch to warm up and it gets our bodies ready to go. to stretch to gain flexibility, if you feel like I've got tight hamstrings or you feel like you know your calves are tight, if you really want to gain flexibility, you have to stretch that tissue when it's hot. So at the ends of your runs, at the ends of your workouts, then when a tissue is hot and pliable, that's when you want to stretch. And you want to hold those stretches for a long time, and you want to stretch until you're cooled down, which may be 15 minutes. And so it's horribly boring. And who wants to do that when you really just want to just, go shower and have a beer and watch TV. But when you really should be stretching your calves and stretching your hamstrings. But that's when the tissue will stretch and stay stretched out. And if you stretch it until it's cooled down, it'll stay there. So think of it as stretching taffy. Stretch the taffy out, put it in the freezer, and it'll stay there. So, yeah, okay, very good. All right. That's all I have for tonight, folks. Actually.